You're welcome to the GH Today News with me, Nanama Acquah, on Thursday, the 24th of April, 2025. Here are your headlines. Doctors Association of Tamale Teaching Hospital suspends emergency services following contentious encounter between Health Minister and hospital staff. And former Director of School of Law describes appointment of Chief Justice Tokonu as a mistake, as he rubbishes the NPP's claim that her suspension is bad precedence. We've got this and much more coming right up. Do stay. You're welcome once again to the GH Today News with me, Nanama Acquah. Now, doctors at the Tamale Teaching Hospital have declared an indefinite suspension of all emergency and outpatient services. The doctors cite hostile working environment, lack of basic medical supplies, and what they describe as an insult to their dignity by top government officials. In a statement released after an emergency General Assembly meeting held on Tuesday, April 22, the Doctors Association of Tamale Teaching Hospital announced that its members would no longer offer services at the General OPD, Antenatal Clinic, Specialist Clinic, and Pediatrics OPD. The protest follows the Health Minister's visit to the hospital on April 22, 2025, and what the doctors have described as false and biased reportage from several media outlets covering the visit. They demand unqualified apologies from the Health Minister and Tamale North MP Al Hassan Suhini to Dr. Valentine Acquah, the entire medical staff, and specifically the team at the Accident and Emergency Department. In the medium term, the doctors are asking for high-tech diagnostic treatment tools, including an MRI machine that does not rely on helium, a CT scan with an infusion pump, mammography, and fluoroscopy machines. The doctors are also demanding public retractions and apologies from media houses that carried what they describe as false and biased reportage of the incident. Now, still on this, spokesperson for the Ministry of Health, Tony Goodman, has categorically stated that the dismissal of the Tamale Teaching Hospital CEO was not due to medical negligence, but rather as a result of poor management practices. He noted that a 3-member committee has been established to investigate the recent death of a patient at the facility. Goodman added that the former CEO had failed to report the hospital's deteriorating conditions through any of the appropriate channels available to him.
When you read read the statement from GMA, you realize clearly that they were thinking that the termination of the CEO's appointment is as a result of the medical negligence. No, that is not it. It is because of the way the hospital has been run down. A teaching hospital that serves 5 or 7 northern part of our country, and then some Togolese and then Burkina Faso cannot even boast of an MRI or CT scan. We believe that the minister has just taken a critical action to forestall that facility and save lives. That is what is more critical. I believe our brothers at GMA who understand this. It is not because the minister thought that there was some medical negligence. He thought that the hospital has been run down. That is why he took the action. Regarding the confrontation with the medical doctor, it is because the space there, you can see it is a space, and then the media you see around. That is why it looks as if there was confrontation. The man said that one life should not blow this matter out of proportion. The minister thought that otherwise. So that was what you saw there.
Now, on to matters of the court. Former director of the Ghana School of Law, Kwaku Ansa Asari, has dismissed claims by the NPP that the suspension of Chief Justice Gertrude Tokonu sets a dangerous precedent. Speaking to my colleague Lily Mohammed on GHOne TV, he argued that the appointment of Justice Tokonu was a mistake, blaming former President Akufo-Addo for what he called a bad decision. His comments come after President Mahama suspended the Chief Justice and set up a committee to probe allegations of misconduct.
When the former president Akufo-Addo made it public that his choice will be Gertrude Tokonu, I was on there to say that he had created a problem for the whole nation. And why did I say that? There were about 5-6 seniors ahead or in front of leadership Gertrude Tokonu. And I said, if the former president thought that by settling on Gertrude Tokonu, he was providing a solution to a problem, then what he had rather done, was finding a problem for the nation. So it will be a problem in search of a solution. That is what has happened. If indeed the petition is meritorious and it is gone into her guilt is established, she should be removed. No problem. If, on the other hand, it is wholly, factually, and legally unmeritorious, it should be dismissed, and the president should, lift the suspension. Period.
Now, the 2024 presidential candidate of the New Patriotic Party, Dr. Mahmoud Bawumia, has strongly dismissed claims that his defeat in the 2024 general elections was due to his religious or tribal background. Speaking at the MPP headquarters on Tuesday ahead of the party's planned thank you tour, the former vice president insisted that the party's defeat was due to voter apathy from its support base. He's urging supporters to avoid divisive narratives and focus on rebuilding the party.
They said that they didn't vote for us because our presidential candidate was Muslim. Have you not heard that? Didn't you hear that? When I heard that, I said, this doesn't make sense. This is not the Ghana that I know. Because if you look at it, we went for primaries. We had 10 contestants. I was 1 Muslim, 9 Christians. But the MPP voted for the Muslim presidential candidate. And when you look at the data is very clear. In many constituencies across the country, the MPP presidential candidate performed better than the Christian parliamentary candidate. In many constituencies across. So it couldn't be, if they were voting because of religion, I shouldn't be performing better than the Christian parliamentary candidate. Even my good friend, Intim, who is giving a lot of heat to the government at the moment in Thailand. Intim is a reverend father in Tim as in South. But I did better than him in his constituency. Notwithstanding our hard work, however, we still suffered a heavy defeat. And when you look at what happened, you will see that it was internal. Many of our supporters did not come out to vote. This is really fundamentally why we lost the election.
Let's move on to some health stories. Bliss GVS Pharma Limited is a pharmaceutical company and has donated anti-malarial drugs to the University of Ghana Medical Center as part of efforts to eradicate the disease from Ghana and beyond. The donation comes ahead of the World Malaria Day, which will be marked tomorrow, April 25.
According to the World Health Organization, nearly half of the world's population is at risk of malaria. Young children and pregnant women are particularly vulnerable to malaria infection and death. To help the fight against malaria, Bliss GVS Pharma Limited has donated 12,000 Ghana cedis worth of anti-malaria drugs to the University of Ghana Medical Center. Speaking to GHOne TV, pharmacist with Bliss GVS Pharma Limited, Kingsley Isuman Boating, highlighted the need to reduce the prevalence of malaria to create a malaria-free generation in Africa.
Our global and corporate social responsibility, we ensure with Bliss GVS, I'm with Bliss GVS Pharma, so we ensure that every year, every medication that we give to the hospitals serves a purpose in reducing the prevalence of malaria. So this year we are at UGMC, University of Ghana Medical Center, to donate some essential medications like Lonart DS, Pialaxin tablets, Lonart dispersible, and some other essential medications to aid the hospital in their fight against malaria.
Director of Pharmaceutical Services at the University of Ghana Medical Center, Dr. Gifty Mensah, said the donation is timely and will aid in the treatment of malaria in pregnant women and children. She also urged Ghanaians to avoid self-medication.
Malaria prevalence is about 8.6% in children aged from about 6 to 59 months. However, we still have to continue fighting. We know that the prevalence is higher in the rural areas compared to the urban areas. And so I would say that we have made significant gains, but we still have to work harder when it comes to malaria.
Public Relations Officer for the University of Ghana Medical Center, Barbara Wusu-Himen, commended Bliss GVS Pharma Limited for the gesture and indicated how the items will help in the treatment of malaria. He also reiterated an open door policy at the facility where healthcare delivery is prioritized.
At UGMC, we have an open door policy here. So once you are sick and you come, we're not going to turn you away that you need to just move to a primary health care center. We try to do our best given the circumstances, and then if you need to move to a primary health care center, we can do that.
World Malaria Day, marked each year on 25th April, brings together the global malaria community to highlight global efforts to end malaria, the need for sustained political commitments and continued investments for malaria control and elimination.
The Ghana HIV and AIDS Network, GHOne, is encouraging Ghanaians to self-test for HIV at least once every 3 months to help curb the spread of the disease. During a safe sex campaign at the La Pleasure Beach, GHOne President Ernest Amma appealed to government to activate the National HIV and AIDS Fund and commit more resources to the national HIV response. The public sensitization exercise formed part of GHOne's nationwide advocacy to promote self-testing and raise awareness on HIV/AIDS. Scores of revelers at the La Pleasure Beach were screened, educated and provided with free condoms as part of the outreach. The initiative aligns with global efforts to end HIV/AIDS by 2030, with self-testing positioned as a key intervention. GHOne President Ernest Amwabeng Otson used the opportunity to renew calls for the operationalization of the long-awaited National HIV and AIDS Fund.
We want government to fulfill its promise and make more resources available towards the fight against HIV and AIDS. Because globally, we have all committed ourselves to eliminating the disease by 2030. It means we need more resources. We need more government commitment to ensure that we will be able to meet the target of eradicating HIV and AIDS. And particularly, on occasion like this, I would like to stress that the National HIV and AIDS Fund, we need it urgently.
Garnet Councillor Joanna Pauline encouraged Ghanaians to know their status through regular testing to ensure early detection and access to treatment.
The HIV is real, so it's better for you to know your status than saying that I wouldn't like to know my status. Because if you don't know your status and you are walking around, I always say that things that we are hiding, I don't want people to point at you. If you don't test it, that thing will come out. And you kind of lose weight, kind of always all the time. So when you test it, you know that one is fine. Then you can move.
Some beachgoers who took part in the campaign praised the initiative and called on young people to prioritize safe sex practices.
You like to enjoy yourself, but you have to be using the condom to prevent yourself, because nowadays you don't know when you might get pregnant.
As long as you're a man or woman, follow sake of sex, because body is not wood. You can meet anyone at any time, but with this you can be protected by HIV.
We have seen massive increase of HIV and stuff, so I think using of condom is very protective. You know, using condoms, you can get HIV, you can get pregnant easily. The condom is going to protect you from getting all that.
Garnet has, over the years, championed awareness through health walks, school outreaches, and media campaigns aimed at reducing stigma and promoting self-testing across the country.
You see a difference. You see Rwanda in Ghana. You see US in Ghana. You see South Africa in Ghana. Everything you want to expect here. So please, I'm pleading that support us, and then be as a leader there for us to enforce. Look at Asin Kushia, just Kushia, the chief alone. Look at what you have done there. You dare not throw a waste on Kushia.
Every day, let's begin to educate our people. And another thing is enforcing the laws, because we've realized that the various district assemblies, their bylaws are not gazetted. If the bylaws are not gazetted, they cannot be enforced. So we want to ensure, we'll meet with our mother ministry. You know, sanitation is currently under the Ministry of Local Government. So we are going to be holding a meeting with the minister to see how best they can help the local assemblies to gazette their bylaws, so that we'll be able to hold people responsible when they misbehave, when they throw refuse anyhow.